We're going to get started, and today's topic is MAT update and overdose awareness. So welcome. We are a part of Public Health Institute, and all of our materials are shared under Creative Commons, and we will be sharing a recording of this webinar in a post-event email you will receive. So today we just want to remind some best experiences, but the number one tip for today is if you look on your chat, if you have a question, I know everybody's chatting in there, but we want to make sure that the blue box is highlighted to everyone. Sometimes when you come on, it says to host and panelists or a specific person. Please make sure that is to everyone, because if you have a question and somebody else might have the same question and they don't see it. So please make sure that you address it to everyone. What is California Bridge's goal? Our goal is 24/7 access to high quality treatment of substance use disorders in all California hospitals by 2025. I am very proud to say our Bridge team, and it takes a team, we have 276 hospitals that are using the Bridge model. So this is just a great accomplishment for our California Bridge team. We've come so far. If you go way back, we started with 19 hospitals. So this is truly, truly remarkable. We're on our way. Real quickly, if you don't know our CA Bridge model, this is what we use and what we train everyone to utilize the new standard of care. It's 3 focuses. The first one, low barrier treatment. That is our healthcare providers, our doctors, nurses, PAs, giving buprenorphine without urine drug screen. A patient can come in and say, hey, I'm having withdrawals. And our goal is that they are fast tracked and they're out the door in an hour or 2, right? That's low barrier treatment, and hopefully with a prescription for buprenorphine. The next 2 focuses are what our navigators do. They connect the patient to care and community. They provide wraparound services, individualized plan of care, and they make sure they're doing a warm handoff to the people in our community. So they feel trusted and they feel hopeful that you guys are given hope. That's bottom line. And then the last is a culture of harm reduction. And I loved this part of it because harm reduction, it starts in your hospital, and it's maybe something very simple that's a huge challenge, I know, in a lot of organizations, is stigma. I know I hear from most navigators, that's the biggest barrier you have. So we know that you are making a difference. And even if it's a Words Matter campaign, we are changing the culture in our organizations. So we're going to go and change the rhythm right now, because we're here for overdose awareness prevention. And as you guys know, Overdose Awareness Day is coming up on August 31st. And let's just talk about the facts. Overdose deaths in the US, it is estimated for 2022, 108,000 lives are lost. Unfortunately, fentanyl has provided up to 70% of those overdose deaths. So we will be talking a little bit about some strategies with fentanyl as well. I just wanted to remember lives lost. And this is Tyler. Tyler was 16 years of age. He is a member of my community. And his father stated he was a good kid. He was a borderline straight A student who lifted weights 6 days a week for sport and crafted his own meal plans. This kid was disciplined. He was a vegetarian and conscious about what he put into his body, which makes his death all more confounding to his parents. They have no idea where and how he obtained fentanyl. So with that being said, for all the lives lost and for Tyler, just 5 seconds of silence, please. Thank you. So we have announcements. I'm happy to say we have restarted our Navigator Focus series. So if you are already registered, please take the moment to re-register for our next Navigator Focus series that runs till March. So our next Navigator Focus series is September 28th, and it's all about promoting your MAT program. So if you need to learn how to give a presentation, use a slide deck, use your stories and your data. We also will be talking about the return on investment tool. And then if you are in LA, even if you're not, if you want to come visit, we're having our last in-person training October 2nd from 8:30 to 2:30 in LA. So we hope to see you there. Okay, so MAT update. You know what, you guys, you know this stuff, but we just want to make sure that you have some statistics, right? This whole bridge model started with an article or research from Dr. Gail D'Onofrio in 2015. She was a MAT champion who did a large study and compared patients starting on treatment as compared to patients that were given BUP and follow up with the Navigator. And guess what? Patients stayed in treatment. Do you see 37 versus 78%? So that's what started our movement. So we know medications for opioid use disorder, although we talk about buprenorphine and Suboxone, and that's what our bridge model, we still want to make sure patients know their choices. Some sites are giving out methadone as well as naltrexone. So we just want to make sure that all of our patients know all of the meds for MAT, for opioid use disorder. So if you don't have our education sheet, we can put that in the chat. That's one thing I forgot today, you guys. We have a sheet that talks about all three, and we will find that and give that to you in our post-event email, so you can go over it with your patients. MAT is the new standard of care, and so we thank you for being here. If you don't know about our quick start algorithm, buprenorphine, it can be found on our website, as well as we can print these out and you can use the QR code. It'll take a second for you just to download that. And so just remember, when you have a doc that says, I don't know, I've never given this before, have this sheet available, and you can definitely make friends with this, right? They don't know what to do. Well, you have a solution. We also have buprenorphine after overdose. I know you guys are seeing a lot of overdoses in your hospitals, in your emergency rooms. So this is another algorithm that can be handy if a patient would like to start. There's also the self-start on bupe for patients to take home when they're not going through withdrawal symptoms, and they don't want to wait. So we have all of these and more on our website, as well as we still encourage you to use the poison control. That's 24/7. If your physician wants to talk to a physician about prescribing buprenorphine, there's also the warm line. The warm line is used, you can leave a message. They do not return your call the same day. So if you have a question for the future, use the warm line. If you have an immediate question, call the California Poison Control. So I am so excited, you guys, that we have Vanessa Lara. If you've been with California Bridge since 2019, she is going to be a familiar face because she was one of the original navigators. And we are so proud and honored to have her today. She is now a project manager for California Bridge. Woohoo, Vanessa, you are just awesome. And she runs the EMS Bridge program. So she's here to talk about this wonderful program for MAT in the field with EMS. Vanessa, take it away.
Hi, everyone. Thank you, Sherrie. Thank you for that lovely introduction. And thank you for having me. I'm excited to step back into the navigator world. It's been a fun journey to see my own journey starting as a navigator and just seeing how the work has expanded and seeing everybody's dedication to the work is really exciting, and I'm super proud to be part of it all. But I'm also excited to talk to you all today about the EMS Bridge and share how we've brought MAT care into the pre-hospital setting. Slide. Oh, if you click through, a couple of articles will pop up. Thank you, Sherrie. So we're not the first to do this type of work, but we were early adopters. The model was first developed in New Jersey, where paramedics screen and identify patients who are experiencing opioid withdrawal, and they administer buprenorphine to those patients right there in the field. What we did was we took their model and slightly adapted it. So paramedics are just one part of a 4-tiered intervention that I'll talk more about. Slide. So EMS was identified as an opportunity because of their unique position as mobile caregivers. And we saw that paramedics have the ability to expand on their work and address this gap in care, right? Because traditionally, emergency medical services, they're only equipped to manage a patient's symptoms out in the field. And they see these patients pretty often that are experiencing withdrawal. But because of constraints in their scope of work, all they can really do is assess, treat, and transport. And that's how it's been for years. So we identified this gap in care where paramedics can do so much more. They can assess, they can screen for substance use disorder, they can provide motivational interviewing, they can have discussions about substance use disorder treatment and options. They can administer buprenorphine. Paramedics are already administering other medications in the field. And they can safely do this as well. They can also provide their community and at-risk folks with naloxone kits, transport to overdose receiving centers or bridge hospitals, and applying a warm handoff to public health and provide continued follow-up to those patients. Slide. So this was our 4-tiered intervention. So paramedics are just one part of this intervention, but there's a whole organization behind this that's implementing this 4-tiered intervention system. So the first is overdose receiving centers or bridge hospitals. We kind of use the term interchangeably, but if a hospital is a bridge hospital, we know that they're equipped to handle and care for patients who have experienced an overdose or are just need some substance use disorder treatment care. So we encourage paramedics to transport these patients to bridge hospitals where they're received by a navigator or other clinicians that are familiar with opioid use disorder and how to care for them. The second intervention in this was implementing an naloxone distribution program into EMS. So surprisingly, before 2020, not many paramedics were distributing naloxone. They were allowed to administer it, via injection. That's very normal, but they weren't given naloxone kits to pass out. And it was kind of like, why haven't we been doing this? And it was really surprising to find out that about only 4 911 EMS agencies had a naloxone distribution program. And because they're mobile, they're able to widely distribute a lot of naloxone in their communities. Our third intervention, of course, was paramedic administered buprenorphine. So again, paramedics are trained now to identify patients, screen them in the field for substance use disorder, but specifically opioid use disorder. And they do call in to base to receive approval. They talk to an MD and just go over the patient's COW score, the other symptoms that they're experiencing, a bit of history, and they're instructed to give their patient 16 milligrams of buprenorphine in the field. And it's quite incredible because we've seen just such great results, and I'll share some results in a bit. And then our fourth piece of this intervention was system integration. So connecting public health, the receiving facility, and EMS. Where we first started this project in Contra Costa County, that was the original county. They have a really unique public health system where EMS and the receiving facilities are all under the public health umbrella. So they're constantly sharing information and talking to each other to be able to follow up with that patient. So paramedics that administer buprenorphine in the field to patients, or if the patients are flagged as possible opioid use disorder patients or having another substance use disorder, that information gets relayed to the navigator, and the navigator then follows up with them. So they don't even necessarily need to be transported to a hospital to receive that information, and patients receive a follow-up. And the patients are given a heads up in the field that somebody will be following up with them later on. And it's been really well received. The patients are very happy to receive just some extra follow-up, extra navigation and support by the navigators. Slide. And these are some of our results, and it's quite remarkable what we've seen. So our amazing substance use navigators at Contra Costa Regional Medical Center, Tambra Devine, who has been leading the navigation work for this project since 2020. Thank you, Tambra, if you're on here. This is what we've seen. So out of a total of 96 patients right now, we're seeing this incredible result where if they're transported to a bridge hospital, patients have a 40% retention rate at 7 days. And then it just slightly drops at 30 days to about 30%, but those are still on par with acute care facilities, other outpatient facilities. So we're seeing some amazing results. And even for the patients that don't go to a bridge hospital, they still receive some navigation. Again, Tambra will follow up with them, taking their contact information that was gathered at their EMS encounter and follows up with them, ensures that they have all of the resources that they need, and they're incredibly grateful. And most patients have been transported. We had one case that was really interesting where the patient was given buprenorphine in the field, but decided to AMA. That's a leave against medical advice or just self-discharge. The patient was alert and oriented. They, felt fine to go back home, and they actually remained in treatment at 7 and 30 days. And we really, that's been the only case, but that makes us really hopeful that buprenorphine is safe, it has a great efficacy, and it made that patient so much better. And also we know that it protected him, for the next day or so after receiving buprenorphine. So we're really, really proud of these results. Now, this is just in Contra Costa County. Slide, please. Now our work has greatly expanded into more LEMSAs. Now, LEMSAs are local EMS agencies. EMS loves to have their acronyms, but essentially in California, there are about 38 LEMSAs, and most LEMSAs are made up of a couple or like a cluster of counties that are neighboring each other. There's about 38 in California, and we have already expanded into 30% of them. And our goal is to really get all of the LEMSAs on board and have all paramedics across California administering buprenorphine. And we're spreading like wildfire. This protocol was only approved for paramedics last year in September. So Contra Costa was special in that they were able to pilot this But because of Contra Costa's amazing results, the MDOC, or the Association of Emergency Medical Docs, approved it for paramedic scope. So it's added to their scope now, and we've moved into these 11 other LEMSAs. And if you haven't already, you'll probably hear from me. We are connecting EMS with the navigators to get everybody on board and set up these systems. So currently there are 6 active paramedic interventions in these counties on the right. And out of those, we've had a total of 130 buprenorphine administrations. So it's really quite remarkable how quick we're spreading. Slide, I think that's my last one. Yeah, and please, I invite you all to scan the QR code, check out our resources. If you think that if you're close to an EMS agency and you think they might be interested, please reach out to us. We would love to host a workshop and talk to any EMS agencies and see how we can support getting them set up. Thank you.
Thank you. That is amazing work you're doing out in the field, Vanessa, just spreading the awareness of MAT. There is a question in this chat. And so this is EMS leaving behind some beyond the administration?
They are not. That's a really great question. They're not. Paramedics are not allowed to prescribe, and that would fall under a prescription, which is why it's really important that patients are, this warm handoff piece is implemented, because navigators will contact them afterwards to ensure that they get their prescription, or once they're at the receiving facility, they are discharged with a prescription.
Okay.
And I still, who do we contact? You can contact our EMS Bridge email. It's EMSBridge@bridgetotreatment.org, and I can type it in the chat as well.
Perfect. All right. Any other questions for Vanessa? I know she's going to stay on, she said. So if you think of something, put it in the chat, because she will stay on during the rest of the presentation. But that's amazing work. I'm so excited and proud of this program. So that's our MAT update. It's going to the field. So thank you very much, Vanessa. So now we're going to go back to overdose prevention and awareness. As you heard Vanessa, they're leaving the Narcan in the field as well. So you have a lot of troops on the ground for prevention and awareness, but in your pocket, you have our mentors. So without me talking anymore, we have our first mentor, Nicole Johnson-Farley. She is from our downtown LA region, and she's going to be talking about overdose prevention. Nicole?
Good morning, everyone. Thank you for joining us. Here I am. We're going to talk about prevention, patient education, and starting low and going slow. You always can use more, but you can't unuse a drug after you have started it. So start with a little bit and use more as you understand the strength of the drug. If you haven't used drugs in a while, your tolerance may have changed. How to manage your relationship with the drugs. Your relationship with drugs may have shifted over time. You can maintain a safer relationship with the substance by taking control of how you use them, as opposed to just following cravings or external pressures. This could include abstinence, taking a break, or frequent use of the drug. Next slide. Identify and education of high-risk patients. We talk a lot about post-overdose, those individuals that have been recently incarcerated or recently in an inpatient setting, or those individuals that have experienced some form of sobriety.
Okay, thank you. Thank you very much, Nicole. Next up, we have Chaia Vang. She's going to be talking about overdose awareness. Chaia?
Hi, everyone. Good morning. I am one of the mentors, so I'm going to discuss some overdose prevention best practices. As I'm sharing, please feel free to drop some tips in the chat too. I would love to know what else you guys do. So always remind our patients to take precaution when it comes to drug use. It's very dangerous for patients to use drugs alone. There's a high risk of accidental overdose with any drug use, as we all know that. So the entire drug supply from cocaine to methamphetamine, Adderall is contaminated, can be contaminated with synthetic drugs like fentanyl. So one of the resources that we use is Never Use Alone, which is 1-800, this 800 number. If patients are planning to use alone, they can call this free hotline number, and it takes the other person, there will be a person on the other line to take down their location and allow for the patient to use anonymously, and they will stay with them and they will call 911 if they believe the patient has overdosed. If the patients are using with friends, ensure that everyone has naloxone and knows how to use it in case they have to reverse an overdose. So another tip that we can do is have community resources ready for our patients. Know your local harm reduction programs, the syringe centers, where to drop off syringes or even unused medications, the drop-off bins. Offer resources and referrals. Definitely one thing we're already doing. Be aware of some sober centers, which can be very different from treatment centers. And then also, if you guys have the time, watch the video, Stop the Void. It's a 20-minute documentary on fentanyl. Very informational and can be a little bit overwhelming too at the same time. But definitely take a look into that. And I want to promote our harm reduction toolkit on our California Bridge website. So it talks about having harm reduction kits ready if you can, naloxone, fentanyl test strips, hygiene products, whatever it is that your hospital will offer you to do. That's something to give your patients. And then connect to your local harm reduction programs to get those materials too. Sometimes they can give you some for free. Do a Words Matter campaign with your staff to help with culture change in our hospital. As we know, we can't do this alone. And then find a champion, someone passionate and has some kind of leadership influence or role in your hospital to help you start this change in your hospital. There is some questions about
Yeah,
video.
the video, the Stop
we could
the
drop the link.
Void. If we could put the link, we'll put the link in the chat. Thank you, Chaia,
Definitely.
so much for all of those tips and strategies. Now we're going to move on to Tommie Trevino. If you do not know Tommie, he is one of the original navigators, and he always has words of wisdom. And Tommie, I would love to hear from you. Are you here?
I am.
It's all right. So he's going to talk. If you don't know Tommie, he's like a likable, approachable guy, and we want to hear from him. What does he talk about to post overdose patients? Because Tommie, those can be challenging people. They want to leave, right? They don't want to hear anything. So tell me, how do you talk to a patient that's overdosed? How do you use your charm? Because I know you're a charmer.
Well, everybody asks me that all the time. I never know when I'm going to speak to a patient. Everybody's different, different age. I'm 65 years old. We get youngsters and we get older people and everything in between. Any kind of drug, somebody just experimenting with it and they happen to overdose. It doesn't mean they're a drug addict or an alcoholic because they come in the emergency room. I just want to help them today. They're in the emergency room, and they're having probably the worst day of their life. Who knows? Let's have been there before. So I just want to help them today. If they come in and say they overdose or they come in withdrawing, I just tell them, hey, there's this medication that is called buprenorphine. We can get you that. We can maybe you're a candidate for it. I don't tell them, I don't make the mistake of telling them, hey, we'll get that for you. That's up to the doctor. I never cross boundaries. I stay within my boundaries. I've learned hard lessons, so I just say, hey, there's this medication you're interested. Let's get the doctor to talk to you about it. And if they do start you on it, hey, you'll calm down. You won't be withdrawing anymore, and we can get those abscesses clean. We can do this. We get you something to eat, and after that, when you leave, you want to get loaded, go ahead. You know, that's up to you. But let's help you today, and I'll never forget that. Harm reduction. It's just, you know, it depends on who it is. If it's somebody drinking 5 bottles of wine a day, and they're coming in every 2 weeks, it's like, hey, dude, you know, can we cut it back to 3? You know, you don't have to guzzle it. You know, sip on it a little bit. You know, and things like that. Like, make sure you buy your drugs from the same dealer. Don't buy them from different dealers. You know, are you buying them in a pill form, a capsule form? Be careful with the capsule forms. They can open them up, put anything in there just to take your money. Or nowadays, there's just a lot of cruel people out there. We know they're out there to rob people and just harm people. And so we have to be careful. I never push anybody. I meet them where they're at, whatever it is they want to do. I built that relationship up with them. I guarantee you they're going to come back. They're going to come back, you know, and that's when I talk to them again. And a lot of times they go, hey, tell me how you been. It's like, how have I been? How you been? How are you doing? You know, let's get you a glass of water. Are you cold? Let's get you a blanket. You know, make them feel comfortable. They're human beings. They weren't drug addicts. They weren't born a drug addict, right? We all know this. And I'm not just repeating what everybody already knows. But I'm myself. I don't care what the rest of the world thinks, you know, and I'm in a different age and everybody can, whatever, you know, I want to help somebody. I'm there to help somebody feel better today.
Thank you,
Sherrie.
Tommie.
Thank you.
Thank you so much. Thank you for your words of wisdom. Do you have a short, brief story that you could tell us about one of your patients?
I have hundreds and hundreds of them. I mean, I have
definitely about an overdose patient. You did one in the rehearsal.
You know, I had a young man. He just turned 21. Nice looking young man, strong guy. He came in twice within a month. The first time was alcohol. And I came in there and I talked to him and he just drank too much. And he goes, man, I'm a bouncer at a club. I'm having the most fun of my life. You know, and I said, dude, you got alcohol poisoning. You came in here. So I educated him on it. And we talked. He says, I'm going to cut back. I'm going to cut back. And he did. And I seen him a couple of weeks later. I go, hey, dude, what's happening? He goes, oh, no, man, I started experimenting with the ecstasy. And I just they got something else. And again, just like I just shared. And I go, where'd you buy them? From the same drug dealer? He goes, no. I go, were you buying the pill form from your first drug dealer? He goes, yeah, how'd you know? I'm just asking. How about the second dealer? Why did you go there? He goes, I couldn't find them. So I found somebody else. They gave me the capsules. And I go, be careful with the capsules. They can open them up and put something in there. And I go, if you're going to party safely. Use drugs safely. And he goes, I am not stopping. I'm having the most fun of my life. I'm not going to stop. And he wasn't going to stop. And that's been 4 or 5 years. I haven't seen him since. I don't know. But it all depends on who it is and what they're using.
Well, thank you. Thank you so much for sharing, Tommie. Thank you. And if you don't know Tommie, you know him. He's everywhere. So thank you again. Next up is Carina Ramirez. She's going to talk about harm reduction strategies. She is our mentor from Long Beach, the Long Beach area. Carina, are you with us?
Hello. Hi, everyone. I want to welcome everybody to the team, and I'm happy that we're going to have more patients to get your guys' help. I'm here to tell you guys a little bit about fentanyl test strips. They can help out to prevent overdoses. It's good information to give to our patients. Here's a QR code. You guys can get this resource on the website. I have these printed out on my site, and I like to give them out to our patients so they can have a handout on some information they can read about. I think it's important for us to tell our patients to test their drugs. There's drugs going everywhere. Most of our patients that are coming into the ED are they're picking up some substance that they didn't even know has fentanyl in there. So it's good to test their drugs. Most of the cases, these patients that are coming in have just picked up methamphetamines. They never knew they have fentanyl inside of there. They're picking up a pill. It's a fake pill. It has fentanyl inside. So it's good to tell them about the test strips so they could test their drugs. The way we were able to get our fentanyl test strips in our hospital, we contacted the local harm reduction program, and they were able to provide us with these test strips. the way it works is kind of like the pregnancy test. They sat the 99-cent stores a strip, and they will reduce their substance with some clean water, dip it in there about 15 seconds. They'll take it out and leave it on a flat surface for about 2-3 minutes, and they'll give you the test. So one line is always going to be positive for fentanyl, and 2 lines is negative. If no line pops up on there, it's because it's an invalid test. There's going to be a link on the chat where you can go and get this resource, and also a website where you can get some fentanyl test strips. It will give you more information on there, and they'll add that on the chat.
Great, thank you. I love the way you went out to the your local harm reduction and got free test strips. I wish all of our navigators can do that, but if you can't, there's also Dance Safe, and there is a wholesale code. If you're a non-for-profit, or if you're giving these out free, there is a discount price. So just want to throw that in there. Okay, next up is Wendy Martinez. And she's going to be discussing safe practices for people who use drugs. Wendy, are you with us?
Yes. Hello, everyone. Hello. I was clicking on that too many times. Hello, everyone. Welcome. So I am going to be discussing safe injection practices, giving some hot tips, navigator tips for discussing these practices with your patients. So we definitely want to encourage smoking, snorting, or ingesting when it comes to any type of substance use. As we all know that when injecting, it increases the chance of a person who uses drugs to get infection, such as cellulitis, MRSA, the neck fash, all those types of things, and also STIs that with sharing needles that can be contracted. We want to try to remind them if they have alcohol swabs available, or even if they purchase a bottle of alcohol at the 99-cent store and some cotton, to try to clean the area if they choose to continue injecting. Another thing that they can use aside from alcohol swabs, if that's not available to them, is just cleaning the area with plain water. It's best if they just pour it over the area without rubbing as much water as they can pour onto the area that they're going to inject into. Again, without rubbing or wiping it with anything that's contaminated. We also want to remind them to not reuse or share needles. The reason being for reusing is that the needle itself gets duller and duller each time, again, increasing chance for infection. And again, we want them to not share due to STIs and also creating more of a chance of them getting infection. We also want to encourage public health screening at your local Department of Public Health. We want to encourage them to stop in and be screened for HIV or Hep C. There are a lot of grants right now for these screenings for STIs to be done in an emergency room setting or urgent care setting. So I would encourage everyone to get to know other hospitals in your area and see if they have availability as well, aside from your Department of Public Health. And one more hot tip, with your Department of Public Health, sometimes they do have buprenorphine providers as well. So it's great for our Medi-Cal patients. Also, check to see if you have a harm reduction coalition in your county. If you do not have one, there are simple things that you can do, as Chaia had mentioned, using a Words Matter campaign in your own hospital. You can make little bags with alcohol wipes. You can distribute the little tiny bottles of water so that they have clean water, or if you're able to distribute saline ampules, cotton, and just put like cotton and alcohol swabs in a little bag would be extremely helpful to this patient demographic. And again, we just want to, and another thing that patients sometimes like to do is lick their needle before they inject. So, we want to encourage them not to do that. Again, it increases their risk for infection. And another place that may be doing a needle exchange program are pharmacies. There are some grants out there for pharmacies to become needle exchange programs. So I would check with your local pharmacies, your mom and pop pharmacies, and see if they're participating in any grants, because that's another place that is offering needle exchange. So that's it. If you guys have any questions, you guys can always reach out to me. Have a great day, everyone.
Thank you, Wendy. Lots of tips. I really like, I did not know that about the pharmacy. So I'm learning today too from all of our mentors. They are wonderful. All righty, let's continue. We have Zenia Cardoza from the Bay Area, Stanford, and she will be talking about naloxone distribution program. Zenia, are you here?
Good morning, everybody. Talking about naloxone distribution program, I can tell you about how we started it here. There's different ways to start it, different ways to apply the program to your hospital. Don't feel that it's one way or another, especially when you start to hit like roadblocks with your hospital. You kind of got to think of how I can get around those. So for our hospital, we ended up doing the naloxone distribution program through social work, because we wanted to make it available not just to the emergency department, but hospital wide. That vision turned into now what is now expanded to all ambulatory clinics, anyone at the Children's Hospital, as well as the everyone on the main campus on the university side. So it's expanded through social work, which is a lot different than a lot of other hospitals and the way they've done it. A naloxone distribution program is important. Probably the most important reason is that even as a provider, you prescribe and you think, okay, they'll pick it up at the pharmacy. And actually the research shows that less than 1% actually even get picked up. Now that could be for various reasons. It could be because the pharmacy doesn't carry it. Pharmacy has a bias about it. There's a large copay depending on insurance, or simply the patient says, you know what, I don't need that. That's for those people. Where we have really had the presentation of naloxone is that it needs to be in everyone's first aid kit. Accidental overdoses are happening everywhere, at playgrounds, at sporting events, so it's we more focus on, we need to be available to save anyone that may be experiencing an overdose, and that can happen anywhere, right? 80% of them happen at home, and maybe it's their first time having medications of that type, or the tolerance is really low. It could be so many different reasons, and of course, we're trying to reduce the stigma, right? This naloxone is only for people that use drugs, but that's not the truth, right? As we all know. So yeah, a lot of the best conversations have been around why start naloxone, why should I carry naloxone? I encourage all staff to carry naloxone in their cars, in their bags, travel with it, right? We become first responders out there. And the worst part about ever watching an overdose is that I could have had Narcan with me, right? So yeah, so the naloxone distribution program was a great icebreaker. icebreaker to introduce harm reduction, to support the MAP program in the ED, to support the addiction medicine team, to support just the culture change at a larger scale for our hospital.
Well, thank you, Zenia. Thank you for your take and how you got this started in your hospital. I know a lot of our navigators are out there doing this whole program. So we know all the hard work you're doing. So if you have any questions, feel free to reach out to our mentors. Our last mentor today is LaToya Mitchell. She's going to be talking about promoting Overdose Awareness Day. LaToya?
Hi, everybody. So whether you are new to what International Overdose Awareness Day is, or you're super experienced and knowledgeable, we have some pretty simple best practices to keep in mind. So some of those are listed here, which are overdose can include fentanyl, it can include opioids, it can include alcohol, stimulants. So when talking about overdose awareness, it's a really great idea to just be aware that it can be individual substances, but also specifically for this day, it encompasses all substances. So keep that in mind, and definitely, send and create awareness surrounding all substances. And when you're sharing statistics and sharing numbers on these overdoses, you'll want to make sure that you're using credible sources. So some of those credible sources would be, sites like CDC or DHCS. Even the California Overdose Surveillance Dashboard is super helpful with, opioid overdose numbers, but you can definitely get overall all substance overdose numbers from CDC and DHCS. And then lastly, getting involved does not have to be difficult. Getting involved can be super easy. It doesn't need to be complicated. And so that actually moves us right along to the next part of ways that you can get involved. So you heard some mention earlier a couple of times actually about doing a Words Matter campaign. That's one way to get involved, and you can do it on a small scale or on a large scale. Shout out to our Navigator Advisory Council, Artemis, Austin, Azzy, Joanna, Leo, Melissa, and Tuesday. They all contributed to many of the ideas that are listed here on the screen for you. You can do things like, passing out ribbons, having a memory board, getting involved with your chaplain at your hospital to provide spiritual guidance or, grief resources. There are all sorts of different ways that you can get involved, and anything to do with harm reduction is a really great way to start. And then that takes us into the next part, which is take action. So what will you do for Overdose Awareness Day? How will you create this awareness and just educate your hospital and or your community? Let us know by sharing on Slack. Feel free to share pictures. We love to see it. You can drop some of your ideas in the chat. We know many of you are getting involved in local table events. It's super fantastic. There's a lot of stuff coming up in September for Recovery Month. So get involved any way that you can. Any little bit and any large scale involvement that you do counts and makes a difference. We have on our next slide, so Austin from Adventist Health Howard shared with us a flyer that they did, and they're doing a day of remembrance and hope. So again, all sorts of different ways that you can get involved. This is a really lovely flyer. I'm loving the purple ribbons, but there are so many different ways that you can get involved. Get involved with one of your local navigators. Dennis is doing a table event at a local, local recovery happens event this weekend, I think, actually. So there's all sorts of things you can do. We're going to be at the Capitol steps in September. So many different ways to get involved, and we want to see it. We want to enjoy and relish with you in the way that you're bringing awareness to the overdoses and the lives lost. So don't forget to share with us.
Thank you so much, LaToya. I really appreciate going over what that call to action. Okay, that's a challenge. So let's show up LaToya with all the things that our navigators can do. So thank you very much. These are the takeaways. We hope verbalize the knowledge of buprenorphine, and you can use our CA Bridge website. We have links in the chat, and you demonstrate overdose prevention strategies. Definitely, we heard from our mentors who are wonderful. They have tons of experience. If you need to talk with them, mentors@cabridge.org is this easiest way to send an email. It goes to all of them. And then naloxone distribution. I did see a question in the chat. Naloxone only reverses an opioid overdose. It does not have any other effects. So I hope I answered that question for you. I see other things, any updates or on xylazine. There was a California Department of Health fact sheet. We can get that to you if you would like. We can send that to you. Just let us know, mentors@cabridge.org. And somebody has a question on advice on HIPAA data collection to do a remembrance board. I think it's a great idea, but concerned about HIPAA. You know what? I would encourage no full names. They can put sister, brother, they can put a first name, a nickname. I don't think that would cause any type of HIPAA concerns. Any other questions? Give a second. All righty. We have a few more minutes if you guys have a question. If you're trying to run a table, please check with the compliance or risk department. Sometimes they step in at the last minute to end your fun. David, I love that advice. You're right. Let people know what you're doing. Absolutely. Remind everybody that it is Overdose Awareness Day, and remind everybody, send out flyers, who you need to know. Very, very important. So I really like that reminder, David. Thank you for reminding us in the chat. We also have CA Bridge Academy. If you have not signed up, we encourage you. That is our learning management system. You can sign on and take our Sun Training 101, and it will provide you with CEUs or a certificate of attendance. We strongly encourage you to go on there on our learning management system, and we will be adding more trainings, especially if you missed one. All of our trainings will be on the learning management system, so you can get caught up. Jewel has a question. Zenia mentioned that less than 1% of naloxone prescriptions are picked up. Where was that study done, and can I get a copy? Jewel, yes, if you could email us at mentors@cabridge.org, and we will get that to you. Are we receiving CEUs for this training today? Yes, on the post-event email, we will send out the evaluation. Okay, anything else? Righty. And again, here is our email at mentors@cabridge.org. Can navigators attend the October 2nd? Absolutely. You can come on down to LA. The registration, we will put that in the chat. Can you see if you can be a CCAP approved provider? Well, Debbie. I am a grantor of wishes today. Officially, as of this training, we can't go back and do everything, but we can do, from moving forward, there will be CCAP. CCAP and KDAP. Those are the two organizations that we have partnered with. All right. Anything else, you guys? Well, we thank you for being here. We have our loyal fan base, and I'm so excited that you're here with us every month. We will continue to be here for you. We know some of your BMP funding has ended, and we continue to be here for your support, along with our mentors. And so always reach out to us. Again, we're here. We can connect you. If you want more information about the EMS Bridge project, please reach out to us. So we're going to give you 3 minutes back to your day. I thank you for joining us, and thank you for all the hard work you're doing out there in reducing stigma and changing lives. We really appreciate our navigators. Thank you.